welcome to the Seasons Hospice page. Thank you so much for joining us for National Healthcare Directives Day. My name is Alexandria and I am the Development Associate here at Seasons Hospice, and I'm joined by Carol. Carol, can you tell us a little bit about yourself?
Thanks. Yes, I'm a chaplain here with Seasons. I've been here 12 and a half years. And 5 years ago, I took some training through Respecting Choices in order to become certified as an advanced care planning facilitator. I love talking with people one-on-one or with couples to discuss what they would like for healthcare options given their own values and situations toward the end of their lives.
Wonderful. Thank you so much for joining me today. And so today we are going to talk about 7 questions that you should really be thinking about when you are starting the healthcare directive journey. So our first question really is, what is advanced healthcare planning?
Yes, advanced healthcare planning is a process. It's something that takes time and that you do it again and again at different times in your life. It's not a one and done kind of thing. So it's a process that begins by choosing someone who can speak for you if you cannot speak for yourself. That person's called your healthcare agent or proxy. Then it means sitting down and thinking about the options that you might face and weighing them with your values and your particular health situation to decide what you would like toward the end of your life. Then it means writing those things down on a form called an advanced care directive, and then giving that form to the people who need it, and then reviewing it every so often.
Wonderful. So you talked about a healthcare agent or proxy. How would I choose my proxy?
Good question. That is the first and most important step you can take in advanced care planning, is choosing someone to speak for you when you cannot speak for yourself. This needs to be an adult who knows you, whom you feel comfortable talking with honestly about your healthcare choices, who's good at making decisions in a crisis situation, because if you're in a car accident or something sudden, or if you have dementia and your cognition fades slowly, either way it will be an emotional time when you're not able to make your own decisions, and they need to be able to be decisive in a crisis. It needs to be someone who can stand up for what you want, even if others are pushing for something different. And it has to be someone who's available by phone or in person to talk with the medical team. It's important to name one person as your healthcare agent or proxy, and then name a second person as an alternate. And you probably will want to consider a different person than who you asked to take care of your financial affairs. That's called a power of attorney. This is called a healthcare agent or proxy or healthcare power of attorney.
What are some issues to consider when writing and talking about your advanced healthcare directives?
We'll talk about 3 major issues today: CPR, help with breathing, and artificial nutrition and hydration. Now, CPR, we've all seen on TV where the first responder comes and it works out just great and the person recovers. Now, in real life, it's not that effective all the time. There are a lot of variables, like how quickly is CPR started after you have the event where your heart stops? How healthy are you? And what other diseases do you have going on in your body? So the closer we are to the end of our lives, or if we have any kind of disease that has compromised any of our organs, not just our heart, that makes CPR less likely to be effective. So this is a great question to talk with your doctor about and learn what your doctor's assessment is about how well you would survive CPR or what would be the likely outcome. And then you make a decision on your healthcare directive. Do you want CPR done or not? The second main issue we want to talk about is help with breathing. There are many things that medical providers can do to help us breathe. And the first 2 are very effective up through the end of life. They are medications that help a person breathe and oxygen. You know, you've seen many people, more and more I think, out and about wearing oxygen tubing and carrying a small oxygen provider with them. Those 2 can help you. There are two more that are mechanical that might have more side effects the older you are or the less healthy you are. They are a BiPAP, which is like a CPAP, but bi means it pushes the air into your lungs and also pulls it out of the lungs. And there's also the ventilator, which we've heard a lot about during this pandemic, people getting on ventilators or not. Now, the reasons these are not as effective toward the end of a person's life is that, or if they have a disease process going on, is that they put a lot of pressure on your lungs, and sometimes a person's lungs can't take that pressure. So those are the two treatments that you're thinking more about when you're making your choices on your healthcare directive. The third issue is nutrition and hydration. Now, it's important to know that if you have surgery or if you have a sudden illness with a good chance to recover, having a tube put in for tube feeding and possibly being on a ventilator to help you breathe can be very useful. This decision that you're making is more for once your health has declined overall and you're approaching the end of your life. In that case, you have more questions to answer, and again, it might be helpful to talk with your healthcare provider. Because as we reach the end of our lives, our bodies wear out and we naturally lose our appetite and our ability to absorb food and fluids. So toward the end of life, a feeding tube may not be helpful, and fluids intravenously may actually be harmful because since your body can't absorb it, the fluid might go into your lungs. So again, it depends on your stage of life, how healthy you are, and what are your goals for your care. Those are the three main issues to think about.
How would I start conversations about my wishes for end of life or for my healthcare directives with either my family or my healthcare proxy?
Great question. Partly this depends on your personality. Some people would want to just sit down with resources and write like in a journal or type online. Some resources have questionnaires you can fill out online to help you get at what you believe and what would be helpful for you or not. Other people might like to use those resources but sit down with their healthcare agent or sit down with their loved ones and start talking with them. And still others might want to sit down with their doctor or nurse practitioner before they sit down with anybody else and talk the issues through with that person. And still others might want to talk with someone like myself or a social worker or a clergy person or a nurse, somebody else in the medical field other than the doctor or nurse practitioner. So there are many different ways to start. I'd say resources that are important to help you start are readily available online. 3 great websites are The Conversation Project, Honoring Choices, and 5 Wishes, and they'll be on your screen later.
So once we've had these conversations, how do we write this down, and are there forms to fill out?
Yes, there are many different forms that you can use, and there's no one right form. Wherever you do your medical care, be it Mayo, Olmsted Medical Center, Gunderson Health System, University of Minnesota, wherever you go for your health care, those medical centers have specific forms. You can also look online at the resources that I just mentioned, and they have forms. I will say if you don't feel like you can do anything other than pick a healthcare agent or proxy at this time, go to Honoring Choices because they have a very simple 2-page form that just asks, who do you want to speak for you if you can't speak for yourself? That's the most important thing to do, and if you can't get any further than that right now, take a look and fill out that form. So it doesn't matter which form you use, any of them will work. The important thing is to start thinking, talking, and then start to write these answers down. One more thing I want to add is that some websites now will allow you to store your form online. I know 5 Wishes does that, so that's another option to consider.
Once we've completed our forms, who should have a copy of my healthcare directives?
Definitely the first copy needs to go to your agent, the person who's going to speak for you when you can't speak for yourself. The next copy needs to go to your medical provider. Again, wherever you go to the doctor, take your form in and they will scan it into their medical record. Your loved ones should have copies so they understand what your wishes are before there's a crisis. And I also keep one in the glove box of my car just to make sure there's one handy. Wherever it can be available, that's a good place to have it.
What if something changes with either my wishes for the end of life or with my healthcare agent?
Alex, I'm so glad you asked that, because a lot of times we think, great, I filled out the form, I'm done with that now. But this is a case where you need to keep looking at this at different periods in your life. Honoring Choices talks about the 5 Ds. If you have a new diagnosis of a disease, if you have a general decline in your condition, if someone near you dies and that kind of changes your perspective on end-of-life care and dying, if you go through a divorce or other big life-changing event, and decade is their 5th one. Every 10 years or so, even if things seem to be stable, you should take that form out and look at it, because as you said, Alex, we change, our preferences changes, and the types of medical treatment available change. So you have to keep reviewing this periodically.
On behalf of the Seasons Hospice staff, thank you so much for joining us for the National Healthcare Directives. If by chance you still have more questions or would like some assistance in filling out the forms, starting those hard conversations, please feel free to reach out to Seasons Hospice. You may message us, visit our website, email us, or give us a call. As always, we hope you have a great day.